Dr. John Oladejo, Director, Health Emergency Preparedness and Response Department with the NCDC, joins us on the program from our Abuja studios. Thank you for joining us at this time. I'd like to begin by asking the latest high-profile person to contract the virus, the governor of Ekiti State. Now, in that case, where and when would we say that the virus is occurring or that it did occur? Are we having a rise in cases? And this is because people are not adhering to the preventive measures.
Very much. As a matter of fact, we are now having what we call community transmission because most of our people, they are not actually adhering to the guidelines which were actually set by the federal government, that they should be using the face mask, there should be social distancing, and they should be washing their hands regularly. So most of our people in the community, they are not actually adhering to it. You know, if you go to some bar, you realize that most of the people that are just walking on the street, you don't see them, wearing the face mask, and then you see people gathering in the evening, over some bottles of drinks. So all these are actually, making the number of cases to rise on a daily basis.
All right, looking at this and perhaps, other high-profile cases, the question really is, how easy is contact tracing? And this is to isolate the cases, make sure that, there isn't a lot of the cases in the community.
Oh, thank you very much. The NCDC provided some guidelines on this. We had the strategies which has been disseminated to the states and the local governments on how to really conduct a contact tracing. More than 200 community volunteers have been trained in each of the states, and our rapid response team, they are in all the states of the Federation, and what they are actually doing is to support the states on how to really ensure that we reduce the number of cases, and then we ensure that all these the guidelines that have been provided are actually followed. You will recall, that initially it was only the people that are coming from outside the country that are actually importing the cases. Then after some time, these people are mixed with the native, and this number of cases are just increasing. And in view of this, the Nigeria Center for Disease Control actually developed guidelines, developed a 4 topical strategy that we're actually using, and we are actually providing funds to all the states of the Federation. That is the federal government, giving funds to all the states of the Federation. And we have what we call IAP, that is Incident Action Plan, which were actually developed by the states in support of the partners at the federal government. So this IAP contain these activities that are going to be executed in the next
to support the states.
Weeks. And this will now improve contact tracing. It will also, improve the strategies of ensuring that we contain the disease in no distant time.
We'd like to thank you.
Say that there will be flattening of the door of the
curve.
So
thank you so much.
What we are actually planning to do.
Dr. John Oladejo, Director, Health Emergency Preparedness Response Department with the NCDC. Thank you for your time.